Hey everyone, Dr. Lipi Roy here, addiction medicine doctor. 4 key takeaways in Matthew Perry's death. 1, ketamine was the true cause of death. Yes, the fact that he was in a pool was secondary, though drowning contributed. At such high levels of this powerful anesthetic, even on dry land, he likely would have faced the same tragic, lethal outcome. Point number 2. Some medications are so powerful and potentially dangerous, they're just not meant to be used at home. Certainly not without medical supervision. Ketamine is one of those meds. Propofol, the medication that killed Michael Jackson, is another powerful intravenous anesthetic. Yes, a doctor administered it, but it should have been given in a hospital under close monitoring, not in Jackson's private home. Point number 3. Buprenorphine did not cause Matthew Perry's death. Buprenorphine, or Bupe, commercially known as Suboxone or Subutex or Sublocade, is a highly effective FDA-approved medication used to treat people with an opioid use disorder or opioid addiction. Bupe was found in therapeutic levels, not toxic levels in Perry's system. Any contribution to respiratory depression, i.e. slowing of the breathing, would have been minor and overridden by the high and toxic levels of ketamine. I have prescribed Bupe to scores of patients with opioid use disorder who are now in long-term recovery. And point number 4, which is the bigger picture. Perry was clearly using substances or medications beyond what was prescribed, and there's multiple reasons. Yes, he was in recovery from his addiction to drugs, but a key and expected part of recovery is return to use, aka relapse. Why was he using extra ketamine? I don't know, but most people relapse for a variety of reasons: depression, anxiety, pain, stress, loneliness. Remember, addiction is a disease of the brain, impairing parts of the brain that control decision-making, behaviors, habits, emotions. It's a chronic disease that needs chronic treatment and care. And that it includes medications, therapy, mutual support groups, and connections to the community, including family and friends. I am heartbroken over Matthew Perry's tragic death, but it was not in vain. He wanted to humanize others with addiction and inspire them to get help. And I firmly believe that he did that, and he's continuing to do that from just another place. Be well.